we are working with the relevant departments, including EMSD and FEHD, for investigation. So there could be possible transmission at those restaurants. For members of the public who stayed at that restaurant after 7:41 p.m. on the 4th of January, please get in touch with us and get tested. Apart from attending school, he worked part-time in Sheungwan and Wan Chai at a tea store, and on the 6th of January, he stayed there from about 11 a.m. to 5 p.m. And on the 4th, he worked at the Sheungwan store. And on the 9th of January, he visited Langham Place, Mongkok Center, Golden Chicken Plaza, and on the 7th of January, he visited Coco at Windsor Place, as well as Pull and Bear, Hyson Place, and Lady Bobo, where he had a drink. We will cover his detailed whereabouts in the compulsory testing notice later today. Another case under investigation involves a 19-year-old student. He worked in Songshan Street of Yau Tong in Block 1 of a building. The student went to Tan Keng Po College in Class 6C. The last day of school was the 7th of January. He attended the school and also visited Central Library, and the student couldn't quite remember his whereabouts. So we will be tracing the places he visited. Upon investigation, it was found that he was a family member of case 12913. He had another address, and his family members would visit his residence in Yau Tong. Case 12913 also visited another home in Causeway Bay. We are investigating whether there are any links between these cases. We are still checking the relevant dates. Another case involves a family member of case 12913 sent to hospital from the quarantine center. For the cases who lived at Mason Building, the genome sequencing results were very similar, so it was a case of vertical transmission. For the person who worked at the hospital, for the genome sequencing, genome sequencing results were not very similar to the passengers on board CX845. So the infection was possibly caused by cases who were infected overseas, and he worked in the orange and yellow zones. In Tuen Mun, new testing centers and mobile specimen collection stations were introduced, and due to increased demand, there were long queues for those who work or live elsewhere. They can consider getting tested elsewhere. We know that a number of elderly people are anxious to get tested. They are wary of being punished if they are not tested in time. And for this, we would provide discretion. We looked at some Leave Home Safe records, and we saw that very often people would scan the code upon entering a premises, but not when they leave. We urge everyone to log out when they leave a premises. That's all. Thank you.
醫院方面嘅情況。
Tala will tell us now about the situation in the hospitals. As of 9 a.m. this morning, over the last 24 hours, the HA had reported a total of 35 cases. As of 9 a.m. this morning, for the past 24 hours, 12 patients have recovered and been discharged. 12,316 people so far have been discharged. As of 9 a.m. this morning, 415 patients are staying at the North Lantau, Infection Control Center, the HA Infection Disease Center, the AWE, and the public hospitals. All these patients are in stable condition. So far, the negative pressure beds number 1,085, usage rate 58%, negative pressure ward 69%, 666 wards in total. So it's now question time. Please tell us the organization you represent before you ask a question. The lady at the left in Point News. I like for the Newtown Integrated Medical Center. Some members of the public have been, injected with an expired vaccine. So what would be the impact? And for the expired vaccines, how are they disposed of? I understand that our colleagues have already issued a press release to explain the situation. I think in general, for the Comirnaty vaccine, they would need to be defrosted and stored at 2 to 8 degrees and have to be used within 31 days. Some members of the public on the 2nd and 4th of January, a total of 11 and 24 patients have been vaccinated with vaccines on the 31st day. We learned about this. We inspected the premises and we asked the persons there about the safety of the vaccines and whether what happened to the vaccines and what was the quality of the vaccines. We've also asked the medical center to follow up on those 36 patients, to follow up on their health conditions. We've also consulted our experts. The preliminary assessment is that the vaccines injected are still effective. But to be safe, we also suggest that the affected citizens, after they've completed the treatment, they should undertake an antibody test to see whether or not the vaccines are effective. Next question. The gentleman over there. Good afternoon. I'm from Now TV. 3 questions. First of all, regarding the cases today for the 20-year-old university student who've actually gone to the hot pot store. What is the risk of transmission according to your estimate? Is it like the case of the Six Garden or the Moon Palace restaurant, and that there might be an outbreak? For the 19-year-old student who studied at the Teng Kim Po College, after he's been found preliminary positive, will his school be suspended? And what's going to happen to the activities at his school? Is there any risk of transmission? Secondly, Dr. Chong said that for the elderly persons, if they go for the test, you will provide discretionary treatment and arrangement. What does that mean? And thirdly, regarding the untraceable case, the security worker who works at Penny Bay, what is the progress of the genome sequencing analysis? If she was infected at Penny Bay, then what is the risk of transmission in Tuen Mun? Are you still very worried about that, as you told us yesterday? Regarding the Ngau Hei hot pot restaurant, we are very worried because for the first 1 and 2 waves, there have been cases where people, went for hot pots and the vaccine became vaporized, and as a result, the disease could be easily transmitted. I think we have similar cases in some restaurants where we had transmission. We are conducting field investigation at the moment to see whether or not the air exchange arrangements there would need to be improved. Of course, we hope that those people who have patronized the restaurant, the Nabi Irana restaurant at the time, they must take a test and inform us. As for the school, we are still finding out if they have implemented all the anti-epidemic measures, because they are relatively, more elderly students, and if the students have been wearing masks, and they will need to undergo mandatory tests. For those who have gone for meals together with the student, they will need to undertake the mandatory test. In Tuen Mun, because of the sudden surge in demand, and we understand that the people in the district, many of the elderly people are very worried. They have to queue up for a long time, and they're worried that they might breach the law. So we will try our best to arrange for them to be tested. We're worried that the old elderly persons are too worried, but I hope that they would not be unduly worried. As for the security worker, there are 2 possible sources of her infection. It could have been Penny Bay, and we do not rule out that possibility. We're still awaiting the result of the genome sequencing analysis. Even without this case, there are other cases where the symptoms will develop at a later stage, and therefore we're worried that there could be a transmission in the district, and therefore we hope that the residents there will go for the test. Gentleman on the right, or lady rather. Cable TV. Regarding the female security worker, we still don't know what is the source of the infection, whether it's Penny Bay or Tuen Mun. In that case, is it a high risk of infection at Penny Bay? In that case, for people who are quarantined there, would there be a risk for those people as well? And for the young boy, you suspect that there is some transmission in the restaurant. For the people who patronize the restaurant at the same time, would they have to be tested as well? And how many people are involved? And also regarding the investigation into that birthday party, do you have any update? And people who hide the information from you, would they have to be prosecuted? For Penny Bay, I think she was wearing a PPE when she was at work. So the risk of transmitting the disease to those under quarantine will be very small, because she had no direct contact with those people who were quarantined there. Sometimes when she answered inquiries for those who are quarantined, she would talk to them through a window, and some of the quarantined persons would may not be wearing a mask, but they would talk to her through a mesh window. As for the possibility of transmitting the disease to the quarantined persons, now since there were windows there and it was open air, so the risk is very small. On the other hand, her colleagues, she would have meals with her colleagues in that container box, and it's possible that they might be infected. If we are confirmed that those people were having meals together at the same time with this security worker, then they will need to be tested, because we've already seen that there is transmission there. It's likely that we have some updated numbers, but I don't have the exact numbers. There seems to be an increase in the number, but I don't have the updated number with me. But it's not a drastic increase. Or those who withheld information, if we have concrete evidence that some people have violated CAP 599D, we'll certainly follow up.
We will take a question in English. The lady at the back on the left, please.
Good afternoon. Several English questions from Martin Shea English News. First question regarding the preliminary case involving the 19-year-old student. Is he a male or female? And can you slightly detail how he might have get his infection from a family member, but somehow he's still not yet in quarantine? Second question regarding the 20-year-old university student who went to the hot pot place. Was he sitting close to the seat of the previously infected patient? Are you concerned about a possible cluster outbreak there? Is it airborne transmission or any possible other transmission venues? And my third question is regarding the Penny's Bay security guard. Can you evaluate the risk of the virus being spread from the security guard to people observing quarantine in that facility? Thank you.
For the 19-year-old boy, he's a boy who studied in the secondary school, living in Yaotong. Actually, we are investigating the possible sources of infection. During the investigation, we looked at he is actually a relative of a confirmed case 12913. Actually, his parents, his mother, live in a place just opposite to the residence of 12913. So further investigation showed that 12913 actually visited the home opposite his residence on 5th of January. This is after repeating questioning, and 12913 actually forgot that incident. That's why we are suspecting whether there's any linkage among the relatives, and we'll put all those symptomatic close contacts to test and quarantine those asymptomatic relatives, and they will be also tested so to find out whether there's any other silent transmission in the family. For the Penny Bay security guard case, as she's wearing full personal protective equipment, including mask and face shield, everything during work, and she has no direct contact with any of those residents. She's only responsible for patrolling and distributing some of the resources, and also carry some luggage to the door of those people under quarantine. And so it's considered that the risk for her to transmit the illness to other residents of the quarantine center is very low. But of course, she has some colleagues who stay with her during meals in a container and work with her. So those colleagues are considered at higher risk and will be quarantined. Oh, yeah. Actually, they are not right next to each other. They have some tables in between. So our colleagues and the EMSD and the FHD and the infection control experts are currently in the site and to investigate the possible linkage, but they are not very far away. I think there are one row of table in between. Yeah. We are concerned because we do not know the exact. We do not actually understand the routes of transmission in these settings, because the ventilation system and also the airflow may vary from restaurant to restaurant. So during previous investigations, we looked at Omicron is very highly transmissible and can be actually airborne.
Next question. Any further questions in English? If not, the reporter on the back row, please. I'm from Mingpao. First of all, the case involving the university student. Which school did he study at? Was he symptomatic? What was his infectious period? When did he last go to school? For the student studying at Teng King Paul College, when 12913 tested positive, did the patient declare that he was a close contact? If not, was information being hidden for the security guard working at Penny's Bay? Do you believe she was likely to be infected in Tuen Mun? Or could she be infected at Penny's Bay? Finally, for the expired community jabs at Newtown Integrated Medical Center, can the center continue to provide services? Would the vaccination services be suspended, and would the center be subject to any penalties? The University of Hong Kong student last went to campus in mid-December. He had a part-time job and he last reported to work on the 6th of January. For case 12913, he did not recall that he once visited this residence. If he did, we would list those family members as close contacts. When he visited this residence, well, some of his family members could not remember that he once went. So for the security guard at Penny's Bay, we need to wait for the genome sequencing results to identify the possible source of infection. As for the medical center in question, I have no details. Next question, please. I'm from Hong Kong 01. Some questions about the cases today. For the 20-year-old male university student who visited Nabe Urawa, how, as far as you know, how many people dined at that place during the same period? Are test results available already for the restaurant staff? For the carpenter, he visited different homes for renovation works. How long did he stay, and would there be a risk of transmission at those homes? In terms of the earlier cases, the untraceable case who was a salesperson, can you give us an update on the tracing outcome? Was he related to the flight attendant? Yesterday, you said that the male flight attendant at Cathay could have infected the person working at the Tuen Mun dispensary. Could the transmission be via the banknotes? Professor Yun said today that we might need to wear 2 surgical masks. Do you think that the risk of transmission for Omicron is high, and would wearing masks alone be adequate? At Nabe Urawa, we are still finding out how many patrons were there during the same period. The restaurant was subject to compulsory testing earlier. I believe all of the staff members were tested, but this is something we need to confirm. For the carpenter, he engaged in renovation work, so he would stay many hours at different homes, between 2 to 4 hours each time. Sometimes he would visit the same home in the morning and in the afternoon. Of course, there would be risks because we are talking about homes. We saw transmission in similar settings in the past, so we do have concerns. For the salesperson, we are yet to identify any links. For 12611 and the owner of the pharmacy, through CCTV footage, we ascertained the period in which they had an encounter at the pharmacy, and the genome sequencing results were also identical. And that is why we believe this was a possible transmission there. it could be an airborne transmission. In terms of the suggestion for wearing masks, we need to hear from the experts.
Next question in English.
Thank you. Question from SCMP. So we would like to ask: are the authorities testing the sewage in buildings in Tuen Mun, and if Tuen Mun is still being deemed as a high-risk area? And also, could we have an update on the number of birthday party guests? Is the list still expanding? Thank you.
I understand the relevant authority, and especially the EPD, they are coordinating the sewage testing with the universities, and they will test all these high-risk areas. Yeah. Of course, including those Tuen Mun areas. And I understand the number of participants in the birthday party has increased a bit, but I forgot the exact number. There have been some increase in numbers.
下一題，呢邊前面呢位啊。
Next question. Oriental Daily. I have several questions. First of all, regarding number 155 Connaught Road West and the premises there, the media has found that there is a sign there, but after the incident, the shop sign has been removed. I understand that the Department of Health has spent some time to find out about the premises and the address and whether or not it's a listed premises. Is it because you were not able to find the shop sign? And is that a deliberate concealment of their identity? Will the CHP investigate into this case thoroughly? And also to follow up on the party, how many people so far has been classified as close contacts? Also, regarding Mason Building in Tai Po, earlier it was expected that there is a vertical transmission there. Do we have the result of the environmental investigation yet? For the Mason Building, I think we have some environmental samples which have been tested positive, and also there are some, indeterminate cases involving the toilets and the pipes. I think the full genome sequencing tests have confirmed that there is a vertical transmission. Regarding number 155, our colleagues already knew about the details earlier. I'm just, giving you the details now. At the time, I didn't know the full details. That is a private premises. We knew about that all along, but we just want to find out whether it's a restaurant or, a private premises. If it were a private premises, I don't see anything that we need to follow up further. The lady at the front. Good afternoon. I'm from the independent media. This is for Dr. Zhuang. Regarding the Whitman Ho's birthday party, there are more people who attended the party. What is the exact number? By how many extra people, additional people have turned up at that airport? Was it 10 or what? And secondly, for 12838 and 12962, have you updated the whereabouts of these two cases? Have you, have you followed up on other close contacts of these two cases? Let me check. I think for the birthday party, we know that 222 people attended the party. And those who need to be quarantined, number 111. Next. Sorry, the speaker's not coming through. No major update. Next. Economic Times. For the number of preliminarily confirmed cases, for the cases you refer to, had these people been vaccinated? What is the CP value and how many close contacts are there? For the hot pot restaurant, is there any buffet, sitting arrangement where people can, pick up their own food? And what's the distance between the seats? 12913, what is the age of the family member who is at the quarantine center and the gender? And also Professor Yun's recommendation that we should wear 2 masks. Will the CHP and HA consider following Dr. Yun's recommendation? And regarding the family member who conceal their whereabouts, so what is the obstacle you have encountered in the course of your investigation? For the family of 12913 is a 20-year-old male, and the 83-year-old person living in Maple Garden had 2 shots of the vaccine, the coronavac vaccine. The decoration worker, the 32-year-old male, had 2 shots of the Comirnaty vaccine. The 20-year-old boy, the 20-year-old male, I don't know whether he's 19 or 20. 20-year-old male, beg your pardon, 12913 is a 19-year-old boy. The preliminarily positive case. The 20-year-old man had 2 doses of Comirnaty. The 19-year-old is not vaccinated. For 12923, the preliminarily positive case and his family member at the quarantine center, I don't have any information so far. For those who violate CAP 599D, that will be the responsibility of our other colleagues, and we've already deferred the details to them, and I don't know too much about the details. Preliminary confirmed local cases are those that I told you about. I have not particularly paid attention to the imported cases. Our colleagues are still finding out at the scene. Sorry, speaker's not coming through. I think there's one whole row of table in between. But I've looked at the plan, but I think we can only know for sure after our colleagues have finished with the investigation. I think, first of all, what I'd like to say is that we are now looking after those who are preliminarily confirmed positive and those who are already confirmed positive. And all our colleagues are donning full PPEs, including the donning of N95 masks. Of course, there would be new information and new, discovery about the chain of transmission and new PPEs and so on. Our experts will continue to monitor the situation and see whether or not we need to make any changes. At the moment, we need more information, and we will listen to our experts. Next, the gentleman there at the back.
I'm from AM 730. For the university student who tested preliminary positive, where did he live? For case 12913, the 19-year-old family member, you said he had multiple family addresses. For the 71-year-old patient, which homes did she visit? Was it at North Point, Causeway Bay, or Yaotong? You said for elderly people in the Tuen Mun, you would offer discretion in terms of the mandatory testing. If for people who visited multiple places in Tuen Mun, is there still a need for them to get tested every day, or could discretion be offered? If a person is required to be tested today, and let's say you are supposed to be tested today, if you were tested yesterday already, but you are unable to get tested today, but you will be tested tomorrow. As long as the tests are conducted within a short period of time, it would be seen as a compliance. For the student at King Paul College, his family lived in Coral Court of Manshan for 12913. The patient lived opposite at Brammer Hill. For the preliminary positive case, he had a separate residence and he would only go there from time to time. What was the other question? For the 20-year-old university student, what was the question? Where did he live? He lived in Shepai Wan Estate Pick Long building in Aberdeen. Any other questions? We can take an additional question. On 155 Connaught Road West. In that from that gathering, how many people have been classified as close contacts so far? There were 3 persons who attended the gathering with the 2 confirmed cases. They were classified as close contacts. And at the same premises, there were 7 or 8 more close contacts. That's the end of the press briefing. Thank you very much. The speaker's not coming through the microphone. If we are able to identify other cases, well, there were times in which we could not identify other cases. We need to see whether there are cases arising from the other cases.